Well, hello again, everybody. Please continue to enjoy your breakfast, but in the interest of time, I think we're going to get our program kicked off this morning. My name is Tim Sink. I'm president of the Greater Concord Chamber of Commerce, and I want to welcome you all for joining us today for a very important discussion. Today, we're going to look at something that's important to all of us in the business community, and it is the rising cost of healthcare in New Hampshire. So the Chamber recently partnered with the New Hampshire Health Cost Initiative, and we surveyed our membership and got some very, very valuable insights from that, hearing directly from folks like you in this room. This is a platform for us to have a discussion, to start taking a look at what are some of the causes, what some of the solutions might be, and how we can keep this discussion going forward, because this is very important to all of us and critical. Excuse me, make sure I have my notes here. We have a terrific panel put together, and very excited to hear from these folks. It is my privilege to introduce our moderator, Lucy Hodder. Lucy is a respected figure in health law, insurance markets, and business dynamics in New England and particularly in Concord, and brings invaluable expertise to our panel. She's practiced health law for more than 30 years. She directs and teaches in the Health Law and Life Sciences program at UNH Franklin Pierce School of Law, and supports health policy research at the Institute of Health Policy and Practice, College of Health and Human Services. Lucy's prior practice was in employment and healthcare systems reform, coverage and payment strategies, Medicaid policy, and medical records privacy. So you can see we have someone who is terrific to moderate this program. We're going to invite Lucy up to the podium, and she will introduce our speakers.
Thank you so much, and great to see you all here today. We are going to jump right in to this conversation because we both value your time and what you have said to us in response to the survey about truly healthcare being a major cost driver for you all and businesses. And that's why we're here today. And we're so appreciative of the Chamber of Commerce coming together to have this conversation. Without conversation, we can't establish a shared understanding. We can't establish a shared set of values. And that's what we're hoping to start today. Thank you for those who participated in the amazing survey that was done by the Chamber with the New Hampshire Health Cost Initiative. You all responded. Healthcare costs are a major concern. Healthcare costs significantly impact your ability to hire and retain employees. And we have an incredible panel here today who are going to talk a little bit about what they heard from you, what they're seeing, both in the insurance industry and also small businesses, and talk about what we can do together. So discussion is key. You know, I've practiced health law for over 30 years, and for many of that was representing employers. And, you know, we've heard this before. The struggle is really important, and solution and conversations are key. But let me introduce our incredible group of panelists and then tell you briefly what's going to happen when they speak. So first of all, we have real experts at the table here. Deb Fournier has practiced, she directs the health law and policy at the Institute for Health Policy and Practice, and has for the past year, and she has a career of health advocacy and policy, working in Medicaid and also with payers and issues and systems concerns, so she brings a wealth of knowledge. She's going to start in a minute by giving us a little bit of an overview of the survey and what's going on nationally. We have Christy Green, who's the Chief Human Resources Officer at SANL, Napa and Concord, and she brings a decades career with human resources in a number of different settings, including in healthcare, and she has a background in health management and human resources, and I think is the incoming president of Seacoast Human Resources Association. So looking forward to hearing from Christy today, tell you a little bit about her experience. And DJ Betancourt, the commissioner of our New Hampshire Insurance Department. Good morning, Commissioner. DJ Betancourt was the deputy commissioner at insurance, and prior to that was with Governor Sununu directing policy. He was very involved in healthcare and mental health policy and insurance, and really brings an energy and a passion to work with employers to the insurance department. So what we're going to do is have each one of them speak very briefly to you about what's going on, what they're seeing, what you all have said, and what the experience is, and then we're going to have a series of questions that they're going to answer, a moderated panel, and then you all get to ask questions. It's your morning. We want to be brief, so we're going to move right ahead and get going. So first of all, Deb, I wanted you to, Deb is going to speak from where she is, so if you can't hear, let us know. I'm wondering, Deb, if you can tell us a little bit about what you saw in the survey and the response, and what of those trends you are also seeing nationally, so we get a really good sense as to what's going on.
Sure.
Take it away.
Good morning, everybody. I am, in fact, Deb Fournier at the Institute for Health Policy and Practice, and I picked out some salient points from your survey results. As the fates would have it, the Institute for Health Policy and Practice has an annual symposium on health law and policy, and has been featuring cost and affordability relative to healthcare for many years. And this last year in February, we focused on affordability and equitability and the national and state trends around healthcare costs. And so it lines up perfectly with some of what we learned. So the things that really popped out to me, and you guys all have this, the results of this survey here on your table. It's a lot of money, right? Almost $8,000 per person, or $21,000 for a family plan, and you're concerned about it, really concerned about it. It is forcing you to make some less than ideal business decisions, which you don't love, but your level of concern is like much closer to the top of the scale than the bottom of the scale. And finally, you noted that you have to, in order to afford the plans for your employees, you're choosing plans with high deductibles because that lowers the premium, right? High deductible, lower premium, so the monthly burden on you and or your staff is less, and that for the majority of them, the deductible is $2,500 or so, and that as a result of these costs, you're unable to contribute more to pay for your employees. There was a lot of discussion about retention and recruitment, a lot of worries about that, and even some notes that your employees reflect to you that they are concerned about the affordability of the coverage that they have, of their out-of-pocket costs. Okay. So first things first, you're not alone, you're not crazy. This is happening all over the country, and we've seen decades of growth in healthcare costs since 1970, right? So this is nothing new, and it isn't just, my point is, this isn't specific to New Hampshire. So what we want you to understand is that it is crowding out budgets for everyone, right? It takes up 20% of the gross domestic product. That simply means that there's less room for other things, for all the budgets, government budgets, business budgets, family budgets, whatever it is. It's one of every $5. It's also, as a result, right, or analogously, a big industry, right? Real dollars. And national health expenditures, so everything that the economy spends on healthcare has gone from a 1.5 trillion industry 20 years ago. It's now $4.5 trillion. And on the left, you can see the service sectors of healthcare. What is taking up different pieces of the pie, of that big pie expenditure, that big expenditure pie, right? So on the left-hand side is the national pie. 30% is on hospital care, and then physicians, and then other healthcare. In our state, we have a very similar proportion. The largest portion is on hospitals, and then other healthcare spending, and then physicians. Okay? So, very much in line. The New Hampshire specific data shows that these prices have been climbing for 20 years and that the average per person expenditure is just shy of $12,000 in New Hampshire. Right? Your survey said, well, we're spending about $7,700 and $21,000 on plans, so very much in line. And the employees are really worried about it. This is a survey of people who have health insurance. And they are expressing an enormous amount of concern about whether or not they can afford their health insurance or their health care costs. And you'll even see people, 28% of the people didn't go to the doctor or delayed going to the doctor because of their health care costs. So this is why you are experiencing all of the concerns around retention and recruitment. There was an anecdote in the survey that said, we've had several people not accept our offers of employment because we couldn't offer health insurance. That's why. Because people are really, really worried about it, even with the insurance that they have. And just to reflect on this is a survey from 2018 of people with employer-sponsored insurance, right? So this is has traditionally in the United States been the gold standard of insurance, right? And folks postponed care, and this was almost tripled when it was someone with a chronic condition. You told us that almost all of the plans of the people who responded offer deductibles, and those deductibles are about $2,500, very much in line with what is going on in the large group and small group markets in New Hampshire. So in the large group market, 60% of deductibles are $3,000 or more, and in the small group market, 70% are $3,000 or more. And premiums are going up more quickly than wages are, which again gets to that last point. I can't show causation here. I can't say this is exactly why you can't give raises, but the data bears out something very consistent with what you are saying, which is because of the healthcare costs that are growing more rapidly, you're unable to contribute more to the pay the way you would like. Okay, so I hope that was as fast as it could be. So just to level set, it's happening everywhere. It's not New Hampshire specific. And the stuff that you reflected in your survey, it's very much in line with current trends in national and state data.
Wonderful. Thank you so much, Deb. And more questions to come on that. So let's reflect on where we are in New Hampshire. Christy, I want to ask you a question here in 5 to 6 minutes. Can you, in reviewing the survey questions and results, can you share a little bit about what challenges you have faced at SANL, what you've experienced as a regional employer with the purchase and selection of health plans, rising cost sharing and employee benefit management? So what are you seeing? What rang true with you in the survey responses?
Well, thank you. Is this working? Yes? Okay. People can you hear me in the back? Okay, great. I don't usually need a mic, so so thank you for having me. Thank you to the Greater Concord Chamber of Commerce as well. It's an honor to be here and to be able to have this conversation. And I hope that nobody is really so surprised by this data. I doubt anybody here is. And quite frankly, if you are, then welcome, because we want you to be aware of this and take this back to your organizations and have a larger conversation about this concern. I have a background as a registered nurse. I started in nursing in healthcare, specifically at the bedside caring for patients. And, ultimately converting over into the healthcare human resources space and now into this, being told to bring the mic closer to me. Is that better?
That's coming in and out. I apologize. So we're going to switch this around.
Switch this.
There we go.
Technical difficulties. Is that better? Yes. Excellent. All right. So, I think ultimately my concern, having moved from the bedside into the healthcare human resources space and now into the larger just human resources space, my job is about people, right? And I care about the people of an organization because our team members are not choosing healthcare. Our team members are choosing to pay their rent so they have a house over their, a roof over their head. Our team members are choosing to feed their families. So our team members are not choosing healthcare from an insurance perspective. And, ultimately, we need to identify how can we help those folks be able to do that. So, from the perspective of what's proportional, Deb mentioned, the proportion of the budgets we're spending on, healthcare costs. We need to also think about, are we truly caring for our team members when we cannot offer them affordable healthcare options, insurance options? Because it's a loop. The loop becomes they don't choose healthcare. They then say, okay, well, I'm going to choose to feed my family. I'm going to choose not to have healthcare. Now we get them going to our emergency departments, where our emergency departments are overcrowded. We don't have enough team members in our emergency departments and in our healthcare spaces to care for these folks, right? It's a big loop. People are leaving emergency departments because they aren't getting the care, they aren't getting access to care. So how do we help identify what's the solution? And yes, we are 100% challenged by receiving, less. We get lots of applicants, but people say to us, I can't come work there because I can't afford to have insurance for my family. And I love that you mentioned. In our worlds, there's a lot of talk about recruitment and retention. I switched that many, many years ago in my language. It's retention and recruitment. We need to figure out how to keep who we have, because the folks out there either they aren't working, I don't know where they are, but they're not working, or they're not choosing to come to our organizations. And maybe it's because that our culture cannot support truly being able to support that healthcare side. So I think there's an opportunity here for us to really have a good conversation this morning. So that's my.
Thank you, Christy. Really helpful to reflect on how this is common amongst employers and how tied it is to retention amongst your employees. Commissioner Betancourt, this is what you all talk about every day at the insurance department. And just wondering if you could give us, knowing there's more time when we have questions, a little bit about how you reflected on the issues raised in the survey, what you're hearing as an insurance department, and how you're engaging employers on these key issues.
I appreciate the opportunity, Lucy, and first and foremost, I want to thank the Greater Concord Chamber of Commerce for the opportunity this morning to talk about this important issue. I am not in the least bit surprised by the survey results that I've seen this morning, because I've been dealing with these issues for a very, very long time. For better or worse, I've kicked around the halls of the State House in some form or fashion for over 20 years. I got elected to the legislature when I was 19. I'm 40 today. It's probably stunted my mental and intellectual development a little bit, but alas, here we are. But you don't have to be in the State House as long as I have, or involved in public policy in New Hampshire as long as I have, to appreciate the importance of small business and business in New Hampshire. It is obviously the backbone of our state's economy, and so as a policymaker, as a leader, you have to be in tune with the concerns and the challenges and the issues that are facing the business community. And over the years, those challenges have obviously changed a bit, and the order of priority has shuffled around a bit. Some years it's a focus on particular tax policy changes, and other years it's what is the state going to do in terms of investing in development. Today, of course, I hear a lot about workforce and housing challenges, but the one constant that has always been on the list in the top 3 over the years that I've been involved has been healthcare. And obviously, it plays into and is directly tied to the other challenges that you are facing, particularly in terms of workforce. This next generation of worker has an expectation of the type of health insurance that they want and that they expect. They want broad networks. They want something that is affordable. And that is obviously a challenge for the business community to meet those expectations while also obviously being able to live within your budgets. The issue, of course, as it always is the quality and cost of the coverage and what you can provide and what you can afford. So the insurance department has been involved in thinking about these issues for a very, very long time under our mandate to promote competitive markets in the state and also to advance consumer protection. And I take a very broad definition of consumer. I believe that it is also the business community as well as the individual. So we think very carefully about these issues. And so to Lucy's direct question, what are we doing? Well, we do a number of different things. First, we try to provide the public with a lot of information so that they can understand what is driving the market in one direction or the other. While we are statutorily required to host an annual hearing every year on insurance premiums and cost drivers, our department really approaches that event with a great deal of enthusiasm and excitement. We would do it regardless of whether or not we were required to. And again, we share a lot of information there so that people understand the background, the trends, and what's driving the current dynamics. In addition, obviously, as Lucy referenced earlier, we maintain our health cost website, which was a first-of-its-kind transparency website that allows consumers to go online, put in a particular procedure they're looking for, put in their particular insurance coverage, and then put in a geographical radius of where they're willing to travel. And it will pull up for that individual all of the providers that offer the particular service that they're looking for and the price that that procedure is going to cost them. Now, if every consumer in New Hampshire were willing to do that and take advantage of that opportunity, you would see a significant and substantive bend in the curve of cost. Unfortunately, and I appreciate the fact that this makes some people a little bit uncomfortable, consumers don't yet think of health insurance as a commodity the way we do with other things. If you're in the market, if you have a need for a new stove or a new refrigerator, you're not just going to go into the first store that you come upon and automatically buy whatever it is you're looking for from that store. No, you're going to shop around a bit. You're going to try to find the best price with the quality that you're looking for, and you're going to engage in that process. Health cost allows consumers to do that with their health care coverage. And in my mind, I'm a believer in the free market system. I think that it serves and has served our state and nation very, very well. But it can only reach its full potential, in my view, when there is transparency, when we are providing the consumer with the information necessary to empower them and to guide their choices. And that health cost website is a great tool to do that. We are constantly seeking ways to innovate with it. We are going to be rolling out a prescription drug component to health cost very, very soon. So please do try to take advantage of that. At present, we are also using some funding made available to us by the federal government, a state flex grant, to analyze the small group market and what the trends are. As commissioner, I've made it clear that one of my priorities is to diagnose and understand what is going on in the small group market and what the future of that market is going to look like. Fundamentally, the problem you have in the small group market is that it is being eaten away at both the left and the right. On the one hand, you have self-funded or ERISA plans that are prominent and are only becoming more prominent, that are drawing people away from the small group market into that arrangement. And on the other hand, you have the individual market, which both the state and the federal government have worked hard over the past number of years to make more affordable to consumers. And so, as I said, it's kind of the small group market is being eaten away on both sides. And the problem becomes, as that pool gets smaller and smaller, you have the principles of adverse selection begin to set in. And what you're left with in that small group market are those who are higher risk. And then the death spiral begins. So we want to understand what we can do. We understand what the current challenges, or some of the current challenges, are with the small group market. In the first instance, the tax credit incentive that the federal government makes available is not adequate to draw and entice more businesses into that pool. And secondly, we understand that there is no help coming from either Concord or Washington in terms of making a large investment in some sort of a reinsurance mechanism to help make the small group market more affordable. And so what we're really focusing in on right now is, what does the next 2 to 5 years look like for our small group market? Are we going to transition away from what it looks like today towards things like ERISA plans, towards things like ICRAs, which leverage a lot of the good work that's been done to make the individual market more affordable? Are there going to be opportunities for people to pursue association health plans, or MIWAs? I hear a lot about that from the business community. So, are those things going to essentially replace the traditional small group market as we understand it today? And what does that transition look like? So those are the things that we're really focused on at the department. And as I said, I think this is going to be a great focus for us over the course of the next 5 years, quite frankly.
Thank you, Commissioner. And tell me if we have it right here, because we're talking a lot about insurance. And remember that you all as employers are hiring people, trying to manage the benefit. There are many people in New Hampshire, of the 1.4 million people, who have Medicare. There are some who have Medicaid. There's some who work for the state or municipal government who have them managing their plans. And then there's businesses, small and large, who are purchasing insurance either through their own resources as self-funded, or they're purchasing insurance from an insurance plan as a fully funded plan. And a lot of what we're seeing is that there's a lot of discussion around Medicare and Medicaid and the state employee health plan, but there's not a lot of collective discussion around what are you all able to purchase, and how is that going, and what are the options for you in terms of your employees and your benefit plan. And so just to talk about the small group and large group and medium group a little bit more. Thank you, Commissioner, for the focus on needing to work with small groups. There are about 59,000 employees in small groups across New Hampshire right now, and many more in other types, and individual coverage. Tell us a little, I'm going to pose this to Deb, a little bit about when we talk about the struggle that employers are seeing and have talked about in the survey around each year getting an additional premium quote and having to make that tough decision about how much of that do we reduce by increasing the deductible. What is that challenge? What's behind those rising deductibles, and what is the impact? Did you see anything in the survey that really talked about the impact of rising deductibles on employees or employers? Why are they used, and what do they do around healthcare access?
So, I don't have any more slides.
You want the mic?
The microphone, yeah. Deductibles and rising deductibles have been a way for employers to continue to offer health insurance, right? So there's an actuarial value of every product. The higher the premium, the lower the out-of-pocket. The lower the premium, the higher the out-of-pocket. And employers, way back when, offered full freight insurance. And when I was growing up and when I was first married, we didn't even worry about it. We didn't see it in the paycheck. Didn't make any difference. But as healthcare costs continued to grow, those premiums continued to grow. And a way for an employer to keep the premiums level is to choose a higher deductible plan. And I think the trend went, first employers shared more of the premium liability with their staff. And then when they went as far as they could with that, they said the only other way to make this manageable is to increase the deductible. So that means someone may have a relatively low monthly payment if they're well, right? And they don't have to use the healthcare delivery market. But they have a high out-of-pocket if they do have to engage with it, right? And your survey results reflect that, because especially the concerns that potential staff and employees relate to you or related to the people who responded to this message. They're worried about out-of-pocket costs. They're worried about managing, it says, last bullet, employees encounter challenges accessing care even with insurance coverage, including affordability of cost sharing, right? And that the overwhelming majority of folks who answered the survey have deductibles that are north of $2,000, very much in line with what we know about where those prices are in the state. But ask yourselves, does everybody have equal access to about $2,500? I can remember a time in my career when we were broke and starting out, $2,500 would have been a big lift, right? You have kids, you're paying for daycare, trying to buy a house, right? So my answer is, it makes total sense that deductibles would have been going up as healthcare costs going up, because it was a way to ease the monthly payment of the premium liability. And now we're at a point where people are making decisions about avoiding care, and that was all over the national data, and it's in the state data too, that people avoid care because they're worried about the cost. They're worried about the unpredictability of it. They don't know if they're going to be hit with some kind of liability that they weren't expecting, and they're worried about how much it will be if they do get an unexpected bill. I made a mistake. There's a slide I should have included that shows that in New Hampshire, 11% of the state and 26% of people who identify as multiracial avoided care in the last year because of cost concerns. So it's not happening somewhere else. It's happening here. And it's for people who are insured. And I think that's the newest advent for DJ's, Commissioner Betancourt's 20 years of talking policy shop at the State House. For the first 10 of those years, it was about, we have to get everybody covered. We have to get everybody into the risk pool, as many lives as possible, and that'll smooth out the risk and that'll smooth out the prices. We're at an all-time high of people being insured, and we still have the cost issue. So I may have gone a little past what Lucy asked me, but that's how I see this information about deductibles being reflected in your results.
Thank you, Deb. And I'm going to turn to Christy for a little bit of a follow-up. The survey that you all participated in, employers reported that rising health costs, as we've discussed, are impacting their ability to retain and recruit. Statements such as, we're not able to offer health insurance and it puts us at a disadvantage when recruiting and retaining employees. I only employ part-time employees who are generally young enough to still be on their parents' insurance. So with this kind of response from employers, how do you see at SANL health insurance as a key benefit to your employees? And how does your healthcare benefit impact retention and recruitment for you?
So that's a excuse me, question that could probably be a workshop, but specifically, I apologize, my allergies are killing me. So, ultimately at SANL, we have about 500 team members, and of that number of team members, a very small portion takes advantage of our healthcare offerings because they can't afford it. And I hear that regularly. So again, as we've been mentioning, retention and recruitment are the keys here. Because if we don't retain the people we have now, we're going to be in trouble over time. What we're hearing within the SANL team, and we have 48 locations. We're in 4 states here in New England, so it's not just New Hampshire. So we're wrestling with other states as well as just New Hampshire, and that is absolutely challenging. And thinking about that, in my own life, I believe in the holistic picture of how a person receives care. And I look at affirmations, and one of my affirmations on a daily basis is that I will balance my personal and my work life. And there's a lot of people in our organization that can't do that. And that's really what I want to be focused on as the Chief People Officer for SANL, is how do I help our team members figure out how to manage their own care, the family care, and be able to come to work, which we're having trouble with that as well, is getting people to actually come to work. And that's part of a culture of an organization. So it's a major key benefit because it helps people, as I mentioned earlier, know that they can put food on their table, they can feed their families, they can have a roof over their head, and they can seek care. And do so in a way that's going to be able to support their life, and that they don't have to have multiple jobs. In our organization, I'm very aware most of our folks have multiple jobs, so they just have to do that in order to pay those bills. And so the impact that's the impact on retention. The impact on recruitment is really around making sure that we have the ability to attract folks that are going to help our business grow over time. And if we don't have the ability to do that, then I don't know how we keep our business afloat. So, I think ultimately everybody in this room, I hope, will take some of this back to your organizations and continue to have this conversation, because having these conversations in a small group here can have ripple effects. And I would ask you all to consider, how can you be a part of this conversation somewhere else? As Lucy mentioned, I'm the incoming president for the Seacoast Human Resources Association. I know there's a Concord Human Resources Association as well, and many of you, hopefully in your organizations, your HR teams are taking part in this, because the benefits conversation is a really important one. And if we don't, as Deb said, continue to advocate for people who need that support, our population health numbers are only going to increase from a comorbidity perspective, and our healthcare population, our population of people is just going to decline from a health perspective, and we're not going to be able to pull it back. It's going to be really hard for us to really pull it back, as we've been talking about.
Thank you, Christy. And I have a follow-up, but I'm going to give you a break because I know you need to drink a sip of water. Thank you for that observation. And the need for conversation across all sectors is something that each one of you is touching on. And Commissioner, we've talked a lot about, okay, at the end of the day, there are lots of actors, employers, providers, hospitals, businesses, and regulators all trying to do the best. But who's really minding the store around what happens on the ground? And our answer is, well, I guess we all better. Tell us a little bit about how you have started to see what's happening on the ground with delivery system, with employers, with your colleagues across the state. How important is transparency, looking at the more complicated details of healthcare together? How important is that in you achieving your mission to make sure healthcare is affordable?
Sure. So as I mentioned before, I think transparency is a huge component of it. The transparency piece, as I said, allows the consumer to enjoy the maximum benefit of the free market system, empowers them with the information that they need to go out and get the best coverage at the price that they can afford. So I'm a huge believer in transparency. Lucy talks about outreach, and outreach is a huge part of what we do at the department. I've placed a very high priority on it. In my career, I've had the opportunity to observe closely and work with two governors of this state who were very popular, John Lynch and Chris Sununu. And I think part of their secret formula, if you will, was they truly believed and stressed adamantly the importance of getting outside of the State House bubble, getting outside of the bubble of the state offices here in Concord, and get out into the community and talk to folks and understand in an intimate and detailed way what the experiences are and what the challenges are of the individuals who have to live and work through those challenges on a daily basis. It is that information flow, it is that understanding of how things are practically working for the folks who are on the street that's going to better inform you and give you a better understanding of the types of policies that you need to consider to address those issues. And so we've, as I said, placed a high emphasis on getting out to chamber events like this, speaking to trade groups, getting out to Rotary clubs and things of that nature so that we can have the conversations that I believe that we need to have to fully understand what the challenges that you all are facing are, and again, help inform us as to the best ways for us to consider how we address them. In terms of trends, as I mentioned before, we are seeing more and more employers who are looking to see what the next generation of coverage is going to be. I've had a lot of conversations with business owners who want to understand more about the opportunities potentially provided to them from association health plans or multiple employer welfare arrangements, or tell us more about what ICHRA might mean for us. And with those conversations, obviously comes frank exchanges about what those opportunities are and what are some of the challenges of those current products and opportunities. And I think that that's going to dovetail in to a lot of very serious conversations, as I've mentioned, over the course of the next several years with policymakers in Concord to make those current innovations a little bit more easier for the business community, as I said, if we're going to transition away from the traditional small group market. But again, getting that feedback from the business community, I think, helps best inform certainly me and my department, but also policymakers as to how to tweak and potentially expand those other opportunities to make them the most viable options they can be for you.
Thank you, Commissioner. And, you know, he always says this, bug him. Here's the information on the screen. And we encourage everyone to communicate with the insurance department about what you're seeing and what your needs are. And they, in turn, promise to bring us all together regularly to have the conversation, because it's more complicated. What you all said in your response to surveys is, as employers, you feel like each year your only option is to go out and get some competition between two different vendors of insurance. Is one going to give you a better price than the other? You don't have a lot of wiggle room in terms of benefit construction. You don't have a lot of wiggle room in terms of options, just which one is cheaper for your employees as you're managing these increased costs. And one of the things that the New Hampshire Cost Initiative we're trying to explore is what else is available as these prices go up to you all, and how can you work together? And Christy, I'm going to ask you, do you feel like there's hope if there is this conversation? I know obviously the health system is big. How can we actually have this conversation together? And are there small, immediate things and large, bigger, longer things? And how do we approach it?
That's a big question.
It is a
You know, I
big,
think
complex question.
I think this putting together a comprehensive benefits package for our team members is a huge challenge. Tailoring that for each one of our businesses and the demographics that we serve is a huge challenge. In having that challenge put before us, I mean, I'm looking at a room of problem solvers. We're leaders in our organizations. So what are we doing in this room? And I would challenge each and every one of you to go back to your organizations and as I talked about before, ripple out and make this a broader conversation. Engage with Commissioner Betancourt, engage with the Institute for Health Policy and Practice, engage with human resources, engage with finance, because this is not just a people conversation, it's a finance conversation, right? We need to figure out how to grow this conversation. And quite frankly, this is a bias of mine, but I don't sit around a boardroom table. So get out into rounders like this, right? Maybe there's workshops that can be done. I've worked with an executive coach in my career, and she calls them world cafes, right? So let's come together in multiple ways to have these conversations to say, what are we doing to solve this problem? I feel, Tim and I talked earlier, we've been talking about this for decades. And, like DJ, I started when I was 12. But we have to have these conversations. And if we don't have these conversations, we're going to continue having this conversation for decades to come.
Hear, hear. Thank you. I'm going to ask Deb a question, and then I'm going to turn to you all for your input. So be ready. Deb, in terms of hearing what's going on in New Hampshire, and as we start to talk about coming together for discussion, are other states doing things around this health cost issue? Not that we are another state, we're always going to be New Hampshire and do it our way, but what can we learn from other states and how they're approaching it?
Sure, right. So, constitutionally, health is reserved to the states. So the states are busy looking at it, and in particularly in New England, several of our New England counterparts are exploring, or have established rather, public commissions that are authorized to collect and analyze healthcare data, not just claims data, also non-claims data, to have a data-driven conversation about what states can do to address the cost drivers and the trends that they see. Some of those states have affixed something called a cost growth benchmark, which is basically a growth target, and have said, we want our healthcare costs only to grow consistent with this rate. And it's an organizing principle around which to have these broader conversations around cost drivers and trends in the healthcare marketplace. There are some states that are being very sort of public forward about it. Colorado, the deputy governor created an office of saving people money on healthcare. For real, that's the name of the office. And through that, they oversaw initiatives that in that state were much more focused on the individual market. They offered a public option insurance plan and established a roadmap, like a framework around which the state could think about and guide its own actions to look to decrease end user cost for healthcare. And some states, like out in California, which I don't typically use as a comparator state because California and Texas are essentially their own countries in terms of their size, and not much that is done there is replicable in a $1.4 million or 1.4 million person state, but is taking a lot more aggressive stance with respect to Attorney General's oversight on healthcare consolidation. The trend of healthcare entities consolidating in the United States is widespread, and many academics believe it is one of the major cost drivers. Very basic economic principle, right? The more market share you have, the higher prices you can charge. And so the Attorney General's office in California has been repeatedly trying to get more authority to oversee potential transactions and to prohibit certain kinds of contracting, to make the contracting process between carriers and providers more competitive. So there's a lot happening. And I wish I could tell you, you know what, this one state, they figured it out. They're so smart. We should just do what they are doing. But I really defer to my colleagues here who are encouraging conversation, because New Hampshire has the benefit of being a relatively small state in which you actually can get your arms around most of the stakeholders and have productive conversations. I don't go with the insurance department on their trips out to see businesses, but just in the work at the Institute, we too have heard from chambers that their interest in the association health plans and the MIWAs is very high. Basically, opportunities for employers to get together and collectively purchase health insurance. And so there are options, but there's no silver bullet. So we have to keep talking to each other.
Thank you, Deb. And New Hampshire is small, but we're certainly not an island with employees coming from surrounding states and our delivery system being inextricably connected with other states as well. I'm looking for hands. Yes, Leslie.
So I am a CPA in Concord. I'm also a business owner, so I have these types of conversations with our clients, as well as every year when we do our renewal on our health insurance. Cost, as you're talking about, has been a major issue. It's come up constantly. And, some of rising costs, we all see the benefits of it, right? New life-saving medications, prescriptions, treatments that are keeping us alive or being treated for things that previously, would not have been. But I think there's a sentiment, whether it's true or not, that a lot of the rising costs that we're experiencing in our premiums have to do with cost shifting. And you had talked about Medicaid and Medicare. And, you've got this public and private market, right? And the public market is negotiating rates that are so much lower than what the real cost of service is. Or the uninsured, again, another component, which is shifting the cost to the people that, like myself, like the other business owners that are paying the premiums that cover that shortfall. So I wondered if, there's anything being done, or if there's any kind of studies looking into that to see how we can rebalance that, right? We want to keep the private market because, we're all live free and die. I want my own choices and that sort of thing. But in reality, right, the government has much more buying power than we do. And so they're pushing the cost to us.
Yeah, and I'm going to turn to ask that question. The panelists, I think one of the things that's really important is that cost shifting, studies may or may not conclude that that's completely accurate, because the entities that are purely Medicaid or Medicare are very efficient and they know what their pricing is going to be, and it's not necessarily shifted as much. But costs are higher for care around benefits. That aspect of the fact that there are going to be people who are on commercial insurance is never going to go away. So the question, Leslie, is a very good one. What do we do about that going forward in terms of our state and how we're going to afford care across the board? And what does that look like to us? Anyone else want to talk about that issue? Deb.
So I just want to underscore what Lucy just said. In our winter symposium, we had some discussion about cost shift. And there's a growing body of work in the literature that cost shift is not the primary driver of healthcare costs. For the reasons that Lucy just said, those entities that are primarily funded by Medicaid and Medicare tend to have a fairly fixed budget and tend to understand their prices and their costs and expenses, and are fairly efficient. There is a much more discussion in the literature in the last 5 to 10 years, 5 years, that healthcare cost consolidation among horizontally and vertically among hospitals and providers is what is driving healthcare costs up. Now, that being said, I completely agree that we now have a joint, whichever way we choose to think about this, we have a joint problem that we have to collectively solve, that there's no one easy way. And I would say also, the Medicaid program in New Hampshire in the last 2 budgets has been putting sizable investments into increasing reimbursement rates for their facilities and providers. So I don't think that your concern has gone unaddressed. I think policymakers have been very interested in trying to make sure that those programs are sustainable for the providers that run them.
My follow-up question to that. So when you say that those Medicaid, Medicare hospitals are more efficient, so Concord Hospital accepts Medicaid, Medicare, and yet when you're billed, right, the bill that I receive as a private insurer, I'm billed more for the same service than Medicaid is.
Absolutely. That's a reality. That's an absolute reality. So,
Variability in price is a real thing, yes.
Yeah, we would need at least a 2-hour workshop to fully plumb the depths of what you've described there. But let me say this. Obviously, cost shift is something that we're very concerned about from a consumer protection standpoint. And I think one of the key pieces to this is going to be that our healthcare providers are going to need to think about how they adjust and innovate in their business models. And I'll give you 2 examples that our department has been very heavily involved with over the course of the last couple of years. The first is when we started to get involved with trying to understand what the challenges that our ground ambulance providers were facing, we discovered pretty early on that the financial troubles they're experiencing come from the fact that 80% of their rides are of individuals covered by Medicare and Medicaid. And those rates are fixed. And the rates that they get for those 80% of the rides of those individuals does not cover their costs. And so what they're trying to do is to fill the delta between what it costs for them to operate and what they're receiving from the Medicare and Medicaid patients by trying to negotiate incredibly high premiums and contracts and rates with commercial providers, despite the fact that individuals with commercial coverage only make up 20% of their rides. That, in my mind, is a cost shift. And so, yes, we're going to work with our commercial carriers to ensure that they are giving appropriate rate, particularly in places that are rural and super rural in our state, because those rides are longer and less frequent. But it is also going to be incumbent on those providers to think about how they right-size their business model and how they innovate, because that arrangement, as I've described it, is not sustainable long-term, and it's putting upward pressure on premiums in our commercial market. The second is, again, an area where there's going to need to be some innovation. A few years ago, I was called by our state's Medicaid director, who said to me, "We've got a problem with labor and delivery units up in the North Country." And I've put forward rates to, I think, either double or triple what we currently pay for that through Medicaid. We need your help to put some pressure on the commercial carriers to do so as well. So we said, all right, well, we're going to really try to understand what's going on here. And what we discovered is even if we somehow were able to lean on the commercial carriers and force them or pressure them to triple or quadruple their rates, it still would not cover the costs of some of those labor and delivery units in hospitals in the North Country because they just don't have the volume. There just aren't enough births taking place up there for those units to be breaking even, much less being profitable. So how those hospitals come together in the future and maybe consider a center of excellence model. It's not just labor and delivery. That was the most recent example, but there are others as well. Because again, what is not appropriate, in my opinion, is an expectation that the commercial carriers, through your premiums, are going to subsidize all of these challenges when what really needs to take place is a great deal of innovation, a great deal of reevaluation of the current business model. And then we can all come together and figure out how all of these pieces can best fit together.
wonderful. And I think that's such a good point, Leslie, that you raise. And innovation and discussion of innovation makes an incredible difference, but it's going to have to happen. because it's happening. Yes.
Yes, Herb Carpenter, Fellowship Housing. I know today we're talking about cost. However, the other component of the medical trend is utilization. And Commissioner Betancourt alluded to it. People want what they want when they want it, and no one's going to tell them where they can go for their services. And I think we've seen a little bit of this with the limited networks that the insurance carriers put out there for a hospital. Literally now, everyone's in the network. Every hospital's in the network. And so isn't part of our solution here to look at utilization and, try and come up with a solution on utilization? And I know that gets at a very sensitive thing with individuals, but
Well, it sure does, and I'm going to ask Christy, you've been thinking a lot about how to encourage employees to, you've seen them be very, very intuitive around what their benefit offers and how to respond to it. Do you want to address Herb's question a little bit about how to engage employees?
Yeah, in varying industries, because again, I think it's easy for us to overgeneralize, right? Which we can say we have an insurance plan for everyone, when the more specialty areas, Herb, to your point, those limited plans were created for a reason, and I'm not sure they got used for the same reason, for the right reasons. And for us to look at utilization across an organization is one thing, but then to do so across multiple organizations is quite another. Again, another workshop with somebody taking notes for workshops for the future. But from the utilization perspective, I'll speak specifically for Sandal Napa. And when I arrived at the organization, we really have a demographic population that is an older population. And we're struggling to attract a younger population. As a result of where we're at in this demographic, our folks are not taking advantage of our health plan, I think for multiple reasons. We do have some outliers who say, I don't need insurance. But we also need to be looking at our claims data. And as we look at our claims data, noticing this trend around utilization where nobody's utilizing anything other than an emergency department when they need to. So, they've got a splinter, they go to the ER, and then the complaint, of course, is that they couldn't get in. Well, how could we have directed them differently? So this is an education opportunity. It's an education opportunity for our team members so that we can help them understand how to effectively utilize the services that we have available to us. And in order to do that, it's really going to take time on the organization's part. And that's an investment from my perspective. So we're investing specifically in team members to say, here's our employee assistance program. It's specific to this, to helping you with financial costs or helping you with financial budgeting. Here's the specifics around our cancer care program through Anthem. If you have several people who are taking, needing to identify how to help get resources for cancer care, what are the resources our plan can offer? Educate those people about that, and it hopefully could help with that utilization access across the board.
So I know we have to wrap up, and we know there are lots of questions, and Tim is going to come up in a minute and tell you how to bring these questions forward. Ongoing engagement. These conversations are so important for exactly what you all have raised. We are a small state. We have a small commercial population that is really struggling. And healthcare is being accessed by all of us. How do we come together to have these conversations and solutions? We call them small p, how can you manage within your organization with each other, but then big P, what's the bigger policy conversations that we can have together with shared values around this. So I want to thank so much the Chamber of Commerce, all of you, the New Hampshire Cost Initiative, which we're so proud to be part of, and the Endowment for Health for supporting many of these conversations and research, and bring Tim up to give us a proper farewell.
I also want to thank our panelists who did an outstanding job, and I want to thank all of you for coming and being part of this discussion. On your tables is an executive summary of the survey, so I would encourage you to take a copy of that. And on the last page, there's a QR code, and this is an opportunity for you to further the conversation. If you've got questions, you have some follow-up that you would like to engage upon, please use that QR code to take advantage of that. So thank you all again for being here, and we look forward to seeing you at a future Chamber event.